Stuart. It's really a great opportunity, and I know Alison mentioned this yesterday in her speech. This is a great opportunity for each of you to have a voice and have input. And I absolutely love the two people that we have facilitating this. So I'm going to invite Frances Wright and Lucy Firth up to the stage to lead you in facilitating some discussions about our workforce. But when you see me stand up, we got it. I'm just letting you know ahead of time because I don't know where the cards are for 2 and 5 minutes. So do you need a 5-minute warning?
Yeah, just in case.
All right, can someone give them a 5-minute warning, or is that my job too? All right, I'll do that one.
Just a big wave.
All right, I'll wave. I'll take this.
Great, thanks Kylie, and thanks to Christine and everyone for having us here today. Lucy and I are both registered nurses working in the Commonwealth Department of Health and Aged Care, working with Alison McMillan, and we're going to run you through a workshop today. A little bit difficult or different in a plenary environment, but we've got 2 microphones down the front here, and we're going to have an interactive display so that you can interact with us using your phones for our questions. So I'll start by thanking the Larrakia people for welcoming us to country and making us feel so welcome, for being here and acknowledging their continuing connection to lands, waters, skies and community. I extend that acknowledgement and my respect to any Aboriginal and Torres Strait Islander people who are joining us both in the room and online. So we all know with developments in healthcare, the growing complexity of consumer care and needs, quality, safety and person-centred care and effective integrated care teams, we're seeing nursing midwifery leaders and their skills visible and active at all levels of the healthcare system: clinical systems and operations, policy, education and research, and every other part of the health sector that we touch. Nurses and midwives are ideally placed to lead quality improvements in healthcare reform, and we encourage nurses and midwives through their roles, their capabilities and capacity to be empowered to influence and impact healthcare environments.
Okay, so I'm going to tell you a little bit about what we've been doing in the Commonwealth, and that might help to stimulate some of your ideas and solutions that we're hoping to hear from you today. So currently we're developing a nurse practitioner 10-year plan. Now we know that nurse practitioners have been in Australia for about 20 years, providing care to across the community in many different areas, but we know that there hasn't been a national approach to how to best use this workforce. So to address this issue, in August 2021, the department commenced work on the development of a nurse practitioner 10-year plan. The plan will describe a set of actions that can be taken to address nurse practitioner workforce issues of a national significance. It will include short, medium and long-term goals. To help guide the development of the plan, there has been a steering committee established, and they continue to meet to discuss the key priorities and strategies for inclusion in this plan. You'll be happy to know that Chris O'Donnell is an ACN representative, and he's also a nurse practitioner on this one. We know that extensive consultation is really key to the development of this plan to support practical, implementable actions and goals. So we've completed the first phase of consultation, where we received almost 500 responses to our online survey. We've held consumer focus groups, we've held yarning circles to really increase that engagement with the Aboriginal and Torres Strait Islander health sector. Since that time with that consultation, we've continued to build the objectives of the plan, refine the long list of the suggested actions that we received, and we're starting to work through the assessment of what are these potential activities, of their feasibility of implementation, the cost and timeliness of these actions. We are aiming to come to you and consult to sense check our draft plan and gauge the level of support that we have with the development of these actions. And so these will be, I encourage you to be involved in these next phase of consultations, which they come through the Department of Health and Aged Care's consultation hub, but we also come through ACN to reach out to you to have your opportunity to have your voice heard. Now, we're also developing the National Nursing Workforce Strategy. Now, this is a huge piece of work, and the strategy will set out a vision for the future of nursing in Australia. Currently, we are in the early stages of seeking approval from all governments, which is Commonwealth and state and territory level, to the approach of the development of the strategy. It will set out priorities to help support a capable and resilient nursing profession, delivering person-centred, evidence-based and compassionate care to Australian communities. Now, the strategy is expected to look at the workforce sustainability, the diversity of the profession, the challenges of regional, rural and remote nursing, and plans to address the pathway from novice to expert and to highlight the pathway to a nurse practitioner. The strategy will provide a framework to facilitate collaboration and action between all stakeholders, government and non-government, on the future nursing workforce planning and policy reform. Now, developing a strategy that supports ongoing development of our profession now into the future is very particularly important right now, given the critical role that nursing has had in the response to the COVID-19 pandemic, as well as the health system synergies that can be achieved with a recently published National Medical Workforce Strategy. To support the strategy, there's also a supply and demand study of the nursing workforce underway. This study aims to take recent data, so from 2015 to 2020, to quantify the nursing workforce in Australia and include future scenario projections of the workforce requirements at the national and state and territory level. The outcomes of the study will inform the development of the National Nursing Workforce Strategy.
So we've called today the National Nursing Workforce Solutions Workshop. Quite deliberately, we want to have a really positively focused, future-focused workshop looking at the solutions. We know the issues, and so we want to keep this future-focused. So we hear from people all the time in government, what they're experiencing in their work, and we want the strategy to be able to address this now and into the future. So we are going to be using Poll Everywhere to try and be interactive with both the people in the room and the people online. And so if you head to pollev.com/nursingq699, that will bring you up to our questions. Our questions that we want you to engage with. We will still be using the app, but we want to interact with you. So there's also 2 microphones down the front here, so feel free and be brave and come up and share your thoughts about solutions and how they might work with the room and with the people online. We really want to engage with you. This is the very beginning of our consultative process. As Lucy said, we're in the early stages, still seeking approvals through government, but we couldn't miss the opportunity to speak to you all and hear from you all on how you think we should direct the nursing workforce of the future. So, Sam, if we can swap to the other screen. Resilience is coming through quite strongly. Working to the full scope, mentorship, empathy, resilience, again. So we're seeing mentorship and resilience coming through really strongly there, which is brilliant. I'm going to try and get to... So lots of mentorship, which is really good. And we've heard lots of examples through the conference over the past couple of days of programs where we've seen mentorship coming through really strongly in local health districts, hospitals and health services and those sorts of things. So it's something we certainly want to address and is something that we do see in leaders, and we need to build that skill and capacity in our nurses coming through into those leadership roles as well. Authentic leadership, we've definitely heard examples about that over the progress of the conference from our keynote speakers, but also from people presenting in each of the concurrent sessions.
Now, Fran, I do have a question that's come up in the Q&A. How do we help nurses who feel stuck and unable to get back into the workforce, including the return to work and nurses with career breaks? We need to rethink how we can invest and attract these nurses.
It's an excellent question, and it's certainly something that we are talking about at a national level, at a policy level. And there is a number of aspects that we need to address in order to bring these nurses back to the workforce. We do have regular conversations with the Nursing and Midwifery Board and AHPRA, and work with stakeholders to try and address some of the barriers to re-entry, particularly people who've had longer career breaks and need to access educational opportunities as well. So we don't have all of the answers, and that's part of what we need to do to develop the strategy, is work with you all to find the solutions to answer questions like this for the profession. So we certainly don't have all the answers, but that's something that we plan to work on over the next 12 months at least in development of the strategy. And as Lucy talked about with the Nurse Practitioner 10-year plan, extensive consultation is a really big part of our approach to this, and making sure that we hear the voices of everyone. We might move to the next question, Luce. So what do you see in the leadership that's working well where you are? So feel free, if anyone's feeling brave, to come down and speak to the room. We do have the microphones here, and our guests online will also be able to hear you. It's a very friendly room. It's not intimidating at all. Again, mentorship coming through as a really strong theme. And I don't know how many of you are involved in the mentorship program that the college offer. So through their career development programs, the emerging nurse leaders, mid-career nurse leaders, there are mentorship opportunities to give mentorship to people as well. So have a think about that next time there's a call come out for mentors. That's really valuable as a mentor to give your skills, knowledge and insights to emerging leaders. Succession planning, excellent leadership initiative. And psychological safety is a big thing, and that's something that we've seen a lot through the pandemic, is the need for workplaces and people to feel safe from a psychological perspective. And again, we heard Alison McMillan share yesterday some of the tactics she's used to help her psychological safety over the last 2.5 years, which have been incredibly challenging. Authenticity, leaders acknowledging career pathways, and that's certainly something that we are building on in the department. And through the development of the Nurse Practitioner 10-year plan, that's certainly something that's been identified, is how do we articulate those career pathways to undergrads and to enrolled nurses and to people, assistants in nursing and care, the care workforce, who may not be considering how they can get through their careers. It's certainly something that we are addressing. Being made to feel valued. I would ask whoever put that one in, or if anyone has, if you feel like you can expand on that a little bit more. What is it that makes you feel valued? What is it that leaders do that bring that value proposition through to you? If we can put some of those sorts of things in, that'd be really great. Anything coming through in the questions, Luce?
No, I'm not necessarily seeing any more come through in the Q&A, but unless it's in the discussion forum, still... It'd be great to combine with the leadership faculty mentorship. It's one of the main priorities. So
they go together, don't they?
Comment.
Oh,
hi,
we've got a brave person. Thank you.
I thought I'd start. My name's Kitty Hutchison. I am the chair of the Nursing and Community faculty here, but I'm also my background is community and primary healthcare and also in education. In our workplace, I work for Queensland Health, and we have very clear career pathways, and our education framework is in that lifelong learning space. In my own area over the last few years, we've put a lot of work into setting up our education aligning really well with the domains of practice in our career pathways, making it very available for nurses to actually do some of that self-reflection, particularly around that performance development time. So the work we have done is actually set the nurses up to be a lot clearer about where they want to go, where their skills and strengths are. And we've had some really great feedback from our NUM group as well, because as the nurses understand that the performance development plan is not about you're not doing this so well, it's really all about them and building their capacity into that leadership space. So I just wanted to share that. Has worked really well.
Thanks so much, Kitty. I'd also want to suggest in this the difference between coaching and mentoring. So there is a difference between the coaching that you might receive through your career and mentoring and using that as a leadership initiative as well. Regular performance appraisals, career coaching, recognising the nurse unit manager as a leader and a key manager in the system. So
a question has come through. Is there a plan for NPs to progress beyond their clinical roles into leadership roles and still being able to maintain their endorsement in the 10-year plan?
So the 10-year plan isn't set yet. So certainly as part of the consultation that's coming up, you can suggest that sort of approach. Certainly, it's something that I've come across through my career working in policy, is that there is a different understanding of how you apply your context of work to your ability to maintain registration. I am a registered nurse working in a policy environment, and because I use my nursing knowledge, I am able to maintain my registration and continue with my CPD. So there are less barriers to moving into leadership roles and moving into policy or roles that aren't traditionally perceived as nursing, and to maintaining your connection to your profession and continuing your role as a registered nurse, as a nurse practitioner, providing you can continue doing your continuing professional development and those sorts of things. So I encourage you to ask those questions of ARPRO or the Nursing and Midwifery Board when you see opportunities come up to move into something that might not be perceived as a traditional nursing role, and challenge those understandings or misunderstandings of what it is that nurses do to maintain your connection with the profession. Another brave soul coming to the microphone.
La Trobe University. I just wanted to make a comment about nurse practitioners and that next step, that question about what might that be. I've just come back from New Zealand after 4 years over there, where nurse practitioners are much more widely in healthcare and much more part of that system. And for them, professional doctorates seems to be a really emerging movement in New Zealand, and I'd like to think that we might consider that as being something to factor into the workforce plan in terms of, I think, developing an evidence base and research for more senior roles, and seeing research for nurse practitioners as being a really good next step.
Absolutely, and building documents that are future focused. It's those sorts of ideas and solutions and inputs that we really love to hear, and those different perspectives. And absolutely, education and evidence is a huge part of building any policy going forwards. I can see my friend Heather here.
Thanks, Frances. Yeah, so Heather Keithley from the board and Rural Nursing and Midwifery faculty. And also in the workforce chapter for the College of Nursing. And one of the things that we've talked about quite a lot has been the clinical reflective supervision approach. And Kylie mentioned it yesterday as well, that clinical supervision being available to all nurses everywhere, no matter where they work, that should be, thank you, embedded. We are also talking a bit more about the fact that potentially there needs to be funding for it to be implemented broadly, so that there's training for people to be good supervisors, if you like, and for people to be able to access that. So what's the funding that we need to make it systematic so it is accessible to everybody, including rural and remote, by whatever means possible. So is it through apps? And I know there were some presentations around apps that are being developed that support virtual supports that can be done, but also side by side working with. So all of the layers that are needed, because if we don't do that wraparound support and love our peers and our colleagues in this way, to allow them to debrief in a way that is supportive, validating and helpful and kind, then we are going to lose. We're losing people already, and we talk about the canary in the coal mine in Chronoplus, talking about rural and remote nurses, that, what's happening out there with the 3-month churn that seems to be, has become systematic is so damaging to cultural safety. And I'll quote my colleague Ryan West there, who talks about cultural humility and being able to learn that. And you can't learn that overnight, and you can't learn it with a 2-hour cultural safety workshop. It needs to be part of a pathway, part of a transition pathway that is supported, embedded, and works with community in partnership. Thank you.
Thanks, Heather. And I would reflect back on making sure that that's available to all nurses regardless of where they work and regardless of what level they work. So from nurses at the bedside or in the community all the way through to management and senior executives, everyone needs that support. Thanks.
Hello, my name is Hayley Pollock. I am one of ACN's emerging nurse leaders. I am a brand new nurse. I'm a grad. Nursing is my second career, so I made a very conscious and considered decision to come into nursing. But I'm hoping you can speak to the government's retention strategy for early career nurses. Been a nurse for 6 months, but I'm already seeing the effect of everybody leaving. And it's disheartening to see that even early career nurses are looking at leaving the profession. So I hope you could speak to that for us, please.
There's absolutely, we're looking for solutions for recruitment and retention. That's going to come as well. We'll take one more here and then we might put the next question up, Lucy, just so we can keep to Kylie's time.
Hi, thanks. Greg Rickard from University of Tasmania and New South Wales Nursing and Midwifery Council. I can't seem to make the question function work on, or find it on the app, but anyway, that's probably me, not your fault. What I wanted to question, we've spoken about scope of practice, but what do we actually mean by that? Is there constraint within nursing, or is it constraint across the system? And I think it's both. Mm-hmm. And I think we need to look at what are the push-pull points both within nursing and external to nursing, if we're going to allow or encourage or enable, I think it's the enable, and enabling nurses to work to their fullest potential or fullest scope of practice. And I think it's critical. The constraint is at time, changes from unit to unit or hospital to hospital or health service to health service. So let's look at that from really at a systematic way, both internally and externally. And I think it's great to be solution focused, but I think it's more than just having nurses in, for example, aged care. What type of nurses? And when you think what's lacking in aged care, it's the whole system that's lacking, or the whole GPs aren't there and other allied health aren't there. So what type of, for example, NPs could we have in aged care? And following on from the comments about rural remote, and I think from Mish Hill's presentation this morning, pathways into remote, so that we're developing them from acute to primary care to community health to rural remote. That's the pathways that need to be really worked through and sustainable. And the pathways need to be education, clinical, with organisational support funded adequately. So I'll leave it there.
Thanks, Greg. There was a lot in that, and certainly I echo your comments on scope of practice. And I think it is there's a systemic approach, but there is also a nursing approach, and we as nurses understanding what is scope of practice and how do we increase it and how do we advocate for those increases where we work. Next question we've got up is critical solutions to attracting people into the nursing profession. Loading. So we've seen being valued come through again, and I'll take it that the comments that are coming in afterwards are what contributes to being valued. So that's the big proposition, and then some of these other things are coming in underneath that as what is going to contribute to being valued. So career progression, career opportunities, work-life balance, or as I like to say, life-work balance. Clear opportunities, more nurses, better ratios. I can see we've got a brave person for a mic. And have you got something else?
And I was just going to say as well, there's been a great question that's come through, which I actually want to throw back to the audience, is what about the mid-career development of experienced nurses? What supports can we provide them? And so that's about, how do we keep them in the profession for longer? But I think we'll throw to...
Hi, my name is Kate. I'm a rural remote nurse, predominantly in agency, and I just wanted to comment, solutions to attract. One of the big conversations I have with people is they want to come remote, they want to try it out. They have the issue that one of our colleagues spoke to earlier was they get out there and they don't stay. And one thing that I've found recently is I've tried to do a grad cert. I get bored because it focuses entirely on emergency practice or leadership practice, and that is such a small part of our practice in remote medicine and remote nursing. We don't support our nurses out there for their primary health or their chronic conditions. We focus so heavily on remote emergency care, maternity emergency care, which are great courses, but then they don't know how to have that conversation that a practice nurse needs to have on a daily basis with someone who's just popping in for a chat. And I think we need to encompass that education, whether that be in a formal graduate certificate, that it's beyond just emergency practice or... Indigenous health is very important. There's usually a unit, but it's only a unit. And that is sometimes the problem. They get out there and they're focused on the mandatories to get there rather than the scope of the actual role.
Great point, really great comment, thank you. And certainly one of the benefits of this being, of us as government leading this work is our access to other departments like education and our collaborative work with the Nursing Midwifery Board and MAC, who have a lot of sway in the education space as well. So I'll go to this microphone and then we'll go to your microphone.
Hello, yeah, my name's Richard. I'm a travel nurse. I sort of travel around the country a bit, and one of the things that I've been looking at in terms of achieving a more resilient rural workforce is I look at these smaller towns like about 2,000 to 3,000, 4,000 people, where you might have a lot of impoverished peoples, single-parent families, culturally diverse, migrant populations that would do really well in a nursing profession, but there's no training pathways to that. They might be working as PCWs in an aged care facility, but there's no facility for them, there's no ability for them to go and become an enrolled nurse because TAFE training is always face-to-face and it might be 1 to 3 hours drive away and they might not be able to afford to do that or have kids or whatever. So I'm just wondering if we can look at more innovative ways to be able to get people from the more disadvantaged backgrounds in rural communities to be able to have a clear and visible career pathway, maybe a staggered approach through PCW, EN training, then on to RN training and then on and further on. And as they achieve each step, maybe get to that diploma in nursing and then they feel the confidence to be able to then go on and do a bachelor. I think that I don't seem to see people talking about that sort of a thing though.
Yeah, great point, Richard, and certainly through, thank you, certainly through the Rural Health Commissioner and her team, they're developing certainly a framework for rural generalists, and we'll start to see that come through a little bit more in the future, but it's certainly a focus, and we'll come to this microphone.
Hi everybody, my name's Sue Hawes. I have worked in the NT and have recently joined Diabetes Australia as the Chief Executive Officer in Queensland. I guess for me, I would like to really challenge our profession to potentially really disrupt, I think, some of the things that we are doing. I think that the time has long passed where we can expect people to stay in roles for a long, long time. And I think that what we need to start to do is think a little bit differently about how we hold, grow people for a small amount of time, but so long as they remain in the profession, that can be a really good thing. But what we need to do is create the pipeline of the next group that is coming through and actually start to get really comfortable with people wanting to move on and experience a whole range of things that actually the nursing profession has to offer. Thanks.
Thanks, Sue. Yeah. We'll come to this microphone here. Get ready for questions, Luce, and then we might move questions.
Thanks everybody. My name's Lee Boyd and I'm the Chief Nurse and Midwifery Officer at Eastern Health. I absolutely agree with that. I think organisations need to look at how we can engage with our workforce and provide opportunities for them to work in other places and then bring them back, and I think that that's a real flexibility gain that we can have. I did just want to challenge this concept of resilience just a little bit because I've heard nurses say, I'm not resilient enough. And it becomes this personal onus, and I totally disagree with that. So maybe we should be having conversations about how can we build organisational resilience, how can we build a resilient team around our nurses to support them. But I would hate for our nurses to leave a workforce or a profession thinking that they're not resilient enough, because that's absolutely not true. Thank you.
Great point, Lee. And it's, how do we, there is a bit of an onus on personal resilience, and, there's structures and systems around us that also need to be resilient to allow us to build those skills for ourselves. And it's also, the last couple of years have seen a focus on the resilience of the nursing profession, but that comes at a cost. And people, I think, forget that part of resilience is being vulnerable and learning and growing through your vulnerability and having the supports and the systems around you to feel that way. So, yeah, very good point. Any questions?
I'm going to keep it moving on because I know we are getting a lot of questions. We might not be able to get to them all, but I think we've got a few more questions that we want to line up and get your responses. So I'm going to skip to the next one.
So how is lifelong learning best supported? So when we build, we're asking big, broad questions today, because when we write a national strategy, we're not going to have an opportunity to get down into some of the detail, and it will be on jurisdictions and employers and those to help realise the strategy at a more local level. And so, what are the big picture things that we need to see to support nurses on our lifelong learning journey? It can be as big or as small as you can think. Funding, such a big word. Scholarships, financially accessible flexibility, organisational cultures that value learning and education. Financially accessible. So it's a really good point. There's a gap between sometimes funding and what is accessible. So bridging that gap is a big challenge. Does anyone want to share with the room? Here we go.
So, Jenny Weller-Newton, so I'm Deputy Chair of the Workforce Sustainability Policy Chapter, but I also need to say I've done a lot of research in workplace learning in nursing and healthcare, so, and ARC funded, sorry. And one of the things I think we often as nurses fail to recognise is the pedagogically rich opportunities for lifelong learning in the workplace. So it's at the patient's bedside, with the client's family, during handover, and it's being able to recognise that those are incredibly important moments in one's journey of lifelong learning.
Yeah, it's those small moments and recognising them. Well, they may not be small moments, but recognising them for the power that they have in our lives. Very good point, Jenny. Thank you.
Hello, my name's Isabella. I was thinking about lifelong learning and education in hospitals, and I was thinking how challenging it has been for the previous couple of years to actually get education. And I think from my personal experience, and I don't know if other people have felt this as well, but I find that education staff have been redeployed just constantly into redeployment roles, into clinical areas, because we just don't have enough staff, there's too much sick leave, and I think because we've had such a lack of education, so I feel like to best support our education in hospitals and keep our, learning, sorry, I'm not very articulate, apologies, to keep people getting their education, we need to protect education staff's roles and, I can't think of a really great solution, but make sure that they stay in their education roles to support everyone else, because everyone says how important education is, and in everything, the way to learn is through education, yet they're almost always the first people to be redeployed. So I think preventing that. Sorry.
Thanks, Liz. Really good point. And I think to that, I would also add, establishing educator roles in places that don't necessarily have access to educators like you often get in hospitals. And I'm thinking of aged care and primary care and community care and places that exist outside of the hospital environment. There's lots of need for education and opportunities in those sectors as well, so I would advocate for that. I think you were at the microphone first, then we'll come to you.
Oh, thank you very much. So I'm Melissa, I'm a Quality and Risk Manager, I'm from Serco. I look at the responses up there and I think they're all very academic, and it's also about professional learning throughout our lives. And as the First Lady said, it's the little bits that help us to reflect and learn from that. And also that I've recently done a leadership course, and the best thing that I got out of that was it's okay not to know everything. And that was a really big eye-opener for me. I always people expected me, because I'm in this role, that I would know everything, but it's okay not to. And that was a really big eye-opener for me. Thank you.
Hi, I'm Belinda from Primary Healthcare Central Australia, Public and Primary Healthcare, sorry. Look, today I've really been encouraged by what one of the speakers said today, is that one of the key things in being a leader is being able to recognise the needs of your team that they might not see, and encouraging that. And I've seen that in my own leadership during this, my leaders in this conference who've offered me opportunities that I'd not even thought of. So thank you for the providers of this conference for that. So as a mid-career nurse, having those opportunities presented to you and your leaders not being afraid to offer them to you, I think is a great way to support lifelong learning.
Very good point. Thank you. Yeah, good.
Something just struck me when I was listening to all of those comments were around, is there room for a national system of recognising micro-credentials that could then articulate to university graduate certificates, diplomas, so...
Idea. I'd love to see something like that. So, like I said, there's no idea too big or too small to come into this Ideas Fest and Solutions workshop. So thank you everyone for, particularly for coming to the microphone to share as well. I think we get to feel the richness when we hear from people in the room as well. So some of the things that aren't making it to the screen that are in the answers, which hopefully you can see on your small screens, but commitment to the provision of paid study leave, federal funding incentives, HECS or help supported places for postgraduate programs, preceptorship. I think that's it hasn't come through in some of the other questions. So preceptorship, I think, is an interesting one. Multiple modes of study. There's also online virtual reality sims for clinical learning. I think the online AI space and virtual reality and simulation and all of those sorts of things are the new world that we need to tackle. So let's think about that. Any questions, Lucy?
No, I'll move us to the next question, which I think we've got some questions and thoughts coming through on that one as well.
Great.
So as we move to really considering recruitment and retention, I think this goes to our emerging leader, nurse leader, who came up before to really ask about how, we want to hear your solutions. How do we retain our nurses? So please chuck them in there.
Lunch. I would ask for some more insight to that. Is that provision of lunch breaks? Lunch breaks. Good. And I would also advocate for those who are managers and leaders in the room here to help your staff. And I know that it's incredibly challenging with the resourcing available, but we can't look after people unless we look after ourselves. I'm a big advocate of lunch breaks. Safe workplaces, reasonable workloads, financial incentives. I'll come to our emerging nurse leader first.
Hello. There you go. Hello, it's Isabella again. I wrote a few down because I had a lot of ideas and I want to actually be able to say them appropriately. I think one of the biggest things, and I think it's been mentioned, is gender inequality. And I find that, nursing is a very female-dominated profession, and therefore, how many women decrease their hours when they have children because they have to work around their husbands or partners to make sure they work and they can look after the children. So my idea was really encouraging men to work part-time, or really making that option so that men can be the ones that work part-time and women can increase their hours and therefore stay in the profession rather than going casually. So that was one way I thought maybe we could break that gender equity barrier but also keep people in the profession. I think everyone knows that clear, patient to nurse ratios is a huge one, and I think that anyone here would think that as well. And I think another thing is just that increased leave entitlements for staff. So, increase maternity leave, increase paternity leave. Some professions, males have a great amount of paternity leave, which means women can come back to the profession and work while men stay at home. I know I'm very gender biased here, but I just think when we're looking at gender equity, it's really important that we do recognise, if men can have those leave entitlements, then women can come back to the workplace. So that's kind of my thoughts. And increasing annual leave entitlements so that we're not so burnt out, we're not only got our 4 or 5 weeks a year. Can we increase that so that we have more time and we feel refreshed and re-energised and go back into the workplace? They're my ideas anyway. Thank you.
Excellent, thank you.
Great to hear from so many of our new nurses. One of the things I think we really don't know in this country is what happens in that sort of 10-year period from graduation through until somebody becomes what I would consider to be a mid-career registered nurse. And something I'm going to put a bid in for, which I've been advocating for a long time, is in the United States they undertook a study called the RN Work Study, which was a longitudinal study that ran over a decade, but it actually went on and was refunded again for another 5 years after that. So they have a much better understanding of the pattern of a registered nurse's working life and some of the pressures that actually make people stay or go. And I would really put a bid in for some more investment in workforce research, as opposed to, I think these are great workshops and I think it's really excellent you're doing consultation, but you're not going to end up with the level of evidence that you would if there was more investment in research in workforce.
Absolutely, thank you. We'll come to this microphone and then we might need to move questions because we've only got a bit of time left, so we'll come here.
Hi, my name is Bella. I think one of the main things that I reckon can affect sort of keeping people in the profession is something that's not really highlighted much, and it's advocating nurses to go more into part-time sort of career pathways that have much less burnout rates. And I think, for example, like this was never discussed at university level. It was never discussed when we were doing our new grad positions. And like we heard yesterday, 60% of new grads actually leave their first job, and it's because of the amount of burnouts that are happening. So if we encourage sort of like a 0.8 workload, a 0.7 workload, which is very common in some parts of Australia, but not at all mentioned in other parts, I think we'd have a much better work-life balance, and we can have much lower burnout rate.
Amazing. Thank you.
Okay, I'll go to the next question.
So what innovative practices are your workplaces using to recruit and retain people? We've heard, over a number of conferences that I've been to this year, none. Yeah. Pizza lunches. Pizza. Food themes. We've heard of organisations taking a different approach to recruitment and onboarding people and orientation and those sorts of things that are really helping people feel comfortable moving into their jobs from the very beginning, because they can network and find people that are also new and experience those things in group situations. And so, those sorts of different approaches to getting people in and then onboarding them and keeping them. Transition to specialty program, that's really interesting. So many have left, I know. And we know that these are some of the problems, but people are moving to other roles and those sorts of things. So what are the attractions of moving to a different role, and how do you bring that into your workplace? We've got someone here.
Hi, I'm Belinda Abbott. Can you hear me? Is that coming
Just give
through?
them 1 sec to try again.
Hi, I'm Belinda Abbott. I'm a clinical nurse consultant at the PA Hospital in Brisbane. COVID has taught us a lot of things over the last couple of years, but one of those that I think is innovative, and I think there's a few organisations that actually utilise this model, is the undergraduate student nursing model of care. So bringing in our students at second year and actually onboarding them to be a part of the organisation, to work within the unit, to be familiarised with the culture and the practices and the policies, and then that way we have already built and grown our own to then employ. So I think that's a really good innovative practice that we should start to look at, so that we start to grow our own nurses.
Amazing, thanks Belinda. And I know that that's a model that lots of people looked to in COVID-19 and in the pandemic, and I think, more than what we'd seen in a long time, there's, registered undergraduate students of nursing and registered undergraduate students of midwifery as well, and, we see those confidence and clinical skills grow in those students and take that into their careers. Thank you. I'm going to, if you can keep it short, because we've got 2 more questions to get to.
I've only just graduated from University of Canberra, just got my registration, so very new.
Congratulations.
Not even in there yet.
Welcome.
But I'm going to go back to a couple of questions of why would I go into a nursing profession, and align it with this recruit and retain. I wanted to do this for 30 years, so you're getting me anyway. But people are hearing the negatives of nursing. I think it might need a program where you show them, emotional. Show them the positives. Yep. So that we are educated. We're not just, we are kind and caring, but we're educated and smart and useful and everything like that.
Thank you.
Hi, I'm Margaret Cusick, Nurse Manager Workforce at Sydney Children's Hospital in Randwick, and I'm just looking up there, how do we recruit and retain our nurses? I think we have to change. We've got to be more flexible. We've got to acknowledge our workforce today want to be casualised. They want to work part-time. We have to change the way we allow our nurses. If they want to work part-time, we've got to support them. Otherwise, we will have no nurses going forward. We just won't have them. And if I look at recruitment today, for every advertisement that's advertised, that nurse will have applied for 3 or 4 other jobs. So we got to change, otherwise we will have no nursing. They're diminishing. They're not there. They're going overseas.
Absolutely. Flexibility is a huge part. And so it's often a huge part of why people choose nursing in the first place. So we will move to the next question. So we have, I mean, it's been an incredibly challenging time during the pandemic, but we have seen, you know, as Belinda shared, some innovations through the pandemic. So what have you seen that's worked and worked well, and how do we bring that and continue that going forwards? Love working in aged care, well done. Bruce on nurses, good. So registered undergraduate student of nursing is the RUSON acronym. Telehealth, huge impact during the pandemic, and the ability for nurses to participate in that as well.
Did you want to say something?
Hello, I'm Ariella. I'm from Queensland. It's relevant to all of the questions, and I'm here to kind of think outside the box and ask the question that I think everyone is hopefully thinking about. But I think we all know a nurse that isn't working due to the vaccine mandates, and that I think this is totally not a reflection of my personal beliefs in regards to the vaccine, but I think I'd love to see what is happening in that space. I know many nurses that have left due to all personal different reasons, but there is so much knowledge and experience in that realm that we're not using and we value. That's what we talk about here is education and value of all of us as nurses in different areas. So it'd be nice to know like what's happening in that space and where are they all going, because yeah, what's happening to them. So.
Good question, and we don't have all of the answers, no. And so it is a good question. And how, if there are people who are choosing not to work in clinical environments now, how can we use them in different ways? So
yeah,
how can we use them for telehealth or virtual health and those sorts of things? I think the pandemic has really forced us to look at alternative models of care, and there's a question coming on that as well. And so how can we use those people and harness their knowledge and skills and expertise in ways that we haven't thought of before, or haven't used greatly in the past? So at this point in the development, we've all got lots of questions and we don't have all of the answers, but it is something that needs to be explored. And not only from the Commonwealth, but at jurisdictions, at employer levels 100%. And those sorts of things as well.
Yeah, thank you.
Great question, thank you. We'll go to the last question, Luz. So models of care is a big idea to tackle, particularly because we know nurses work at every aspect of the health system. There isn't really one part of the health system that nurses don't touch, and so context can be really challenging in this, but what's working where you work? So what have you seen that's worked for you? Telehealth, huge. Hospital in the home, virtual care. I need to refresh this screen. So on my screen I can see bedside handovers, nurse-led programs, nurse-led discharge, mobile trial avoid, amazing. Multidisciplinary team collaboration, we love that. I'll go here to the microphone.
Hi, my name's Felicity Williams. I'm Nurse Manager Professional Development at Hunter New England Health. One of the programs that we had developed before COVID but has emerged as being really useful during COVID is a wound management patient image capture portal. So it enables our wound management nurses, of which there are thin on the ground, to actually review wounds in a very large health service virtually and provide virtual consultations to patients. And this program is being really innovative, and it is making a huge difference to our patients.
Amazing, thank you. Have I got 30 seconds? 30 seconds.
Nice quick question. My name's Caitlin and I'm an emerging nurse leader as well. I've just started my new grad program in an ICU, and what was implemented during the COVID-19 pandemic is they had a WebEx system that was set up so they could actually have a teleconference with family members with the COVID patients inside the rooms. And I think it's coming back, to access, but it's also coming back to family involvement as well. In those times, there was visitor bans for every patient at one stage, but for those COVID patients that couldn't even get a hug or any physical contact, and at times were, so sick that they couldn't pick up a phone, bridging that gap and being able to have an access to communicate with family members was very invaluable. It was amazing.
Absolutely, thank you. So I've got Kylie hovering over my shoulder, so I will, don't worry about changing back, Sam, we'll just finish off. Thank you so much for your generosity in sharing with us today. As I've said a few times, this is only the very beginning of our work in this space, and we really look forward to hearing from you all as we continue to develop the strategy. Look out for your emails from the college. They're very good at sharing consultative opportunities, and I encourage you all to participate. Thank you again. Enjoy the rest of today.
Thank you.
Fran, I hover with love.
I know.
And there's so many different thoughts. You can feel just a whole array, and I know that for me it sparks more. So Fran's absolutely right. We'll get the opportunity for more consultation so that the voice and the message will continue to get through to your office. Thank you so much for facilitating this. I know you two have been putting this together for some time, and it's a major piece of work. And you know the enormity of what you're doing and who you're representing, so we really appreciate it. Little gift for both of you.